Moxie Media presents Diabetes Risk Reduction. In the year 2004, over 20 million people were diagnosed with type 2 diabetes in the United States, with at least another 5 million who had it but were not yet diagnosed. Many more people are pre-diabetic or borderline diabetic, and as a consequence have a 10 times greater risk of heart disease than people with normal blood sugar levels. It is predicted that today 1 out of 3 people born in the United States will develop type 2 diabetes. The good news is that diabetes, one of the leading causes of blindness, amputation, and cardiovascular disease, can be controlled and prevented by changing dietary habits and avoiding sedentary lifestyles. Dr. Richard Bunch, an expert in health and wellness, will present the most common risk factors for this disease and describe the best methods that will effectively prevent and manage type 2 diabetes.
Okay, diabetes has become a national epidemic in America, and of course because of America's love affair with high glycemic or foods that break down the sugar rapidly into the system. We're seeing fast foods, we're seeing all type of industries that are today offering people foods that are really highly glycemic, break down quickly, and we need to understand what that does. It's one of the leading causes of amputations. 60% of all lower extremity amputations are a consequence of diabetes, usually type 2. Blindness, you've heard of retinal neuropathy. If you haven't heard of it, is when the nerves to the eyeball becomes damaged. The eyeball is nothing but one big nerve. It's the only part of your brain you can see from the outside of your body. When you look at my eyes, you see in my brain. That's scary. Okay? So diabetes is the leading cause of new blindness among adults 20 to 74 years of age. Diabetic neuropathy causes about 12,000 to 24,000 new cases of blindness each year. Isn't that amazing? The amount of blindness among people about going blind, diabetes, the side effects of diabetes is one of the leading causes of blindness in this country. It's also one of the primary causes of premature death from cardiovascular disease and strokes. People who are diabetic have a much higher risk for having a stroke or a heart attack because of the effects of diabetes on the blood vessels and on the heart itself. The risk of heart disease and strokes among diabetics over age 45 is extremely high. 73% of all diabetics have high blood pressure. And you wouldn't believe how many diabetics that I evaluate who are not monitoring their blood pressure. That amazes me.